All right, so after watching this video, what are some things that you saw? What are some common themes that you saw?
They all feel like rewarded from the job.
Yeah, all of the staff feels rewarded from their job, and that's something that I think the physical therapy profession has greater than what most professions are. We get to spend a ton of time with our patients. We get to return them to life and maximize the life that they have. Um, Beyond what most professions can do, and anywhere in the medical field, I really think we have something special here. So we call that internal satisfaction. The internal satisfaction we get from our careers in the PT world is way better than what most get. So that's great. Great observation. Any other observations?
A lot of variety and like very support.
Yeah, absolutely. What kind of settings did we see? Like, what were some of the locations we saw that the people worked at?
Middle schools, hospitals.
Yep. Hospitals, middle schools, good. What's that? The army facility. Yeah, that was a hospital that's just for the army. So, yep. What else? Nursing home. Yep. One of the places was just an outpatient place. Who said they work at an outpatient place right now? Yeah, you too. Where do you work? Yeah. Yeah. Yep. So yeah, bunch of different settings. The big ones we're gonna talk about: hospitals, skilled nursing facilities, home care, and outpatient. Schools is the other one that we'll talk a little bit about. And we'll expand on that later. But yeah, a ton of different variety in our field. Absolutely. Good. Any other common themes you saw?
Like a longer term approach rather than a lot of the other healthcare kind of just just like getting down to like the actual college.
Yeah. Yeah, definitely. Yeah, there's definitely a longer term play with this. That's for sure. Yeah, we're looking at progress over weeks, months, and sometimes years at a time, not take this pill and call me in a few weeks, or I'll do the surgery and the net structure is fine. You go figure it out the rest of the way. So yeah, that's definitely true. Anything else? How many smiles did we see? A lot, right? A lot from not only the therapist, but also the patients as well. Did you guys see the interaction between patients and staff, patients and therapists? What did you guys, any observations about that? Yeah, having a friend, having somebody that's gonna work really hard with you. Yeah, and I think the ones that stood out the most for me are the Walter Reed Army Hospital. How you have a bunch of 20 somethings that have had their life completely altered, and then a staff that's going to go rock climbing with you, go for a run with you, like, I mean, work out with you, drop sweat with you, like that's something that's really powerful. I think the other one I saw was the school physical therapist working with all of those kids, and how hard that guy worked, and the connection between his patients and him, I thought was really powerful. And I think that's something that's so important for us to always remember. It's the connection between the patient and the therapist needs to be strong in order to get anywhere with it. So, and what? Open-minded of the patient. Yeah, and the patient has to trust their therapist, that's for sure. um Good. Anything else? So we covered work environments, what the patients were like. Big variety of patients, right? I mean, from kids up until adults. One person said she worked mostly with geriatrics. Um, Geriatrics means what? Older adults. Yep. Um, so I will tell you, I'm not a pediatric therapist. That's a skill set that my wife is, but it's a skill set I don't have. Even not being a pediatric physical therapist, the youngest patient I ever worked with was 3 years old. That was pretty fun. Um, and the oldest patient I've ever seen was 103. And that was a lot of fun too. So yeah, big variety of patients. We got athletes, returning soldiers, students with disabilities, run of the mill aches and pains. We got plenty of those too. So the patients that we can see are very vast. So the definition of physical therapy is treatment of disease, injury, or deformity through physical methods as opposed to drugs or surgery. So again, that's the physical methods that we are looking at. I want to talk briefly about the APTA. The APTA is the American Physical Therapy Association, nonprofit, member-driven professional organization that oversees the entire profession of physical therapy. Any student, PTA, PT, or licensed PT or PTA can be members and then have their voice heard. Now, here's the thing, what I mean about that oversees the entire profession of physical therapy. So you don't have to be a member, it's not required. I think it's a great organization, and everything good that happened in my career, I could trace back to happening with the APTA. I started teaching because of the APTA. I was at a continuing ed course. I had a old professor waiting around, and I mistakenly said, "Hi, how are you?" And she said, "I don't have anybody to teach on Monday." This was a Thursday night. And I said, "Oh, what time is class?" I've got a flexible schedule. She says, "I'll email you tomorrow." She emails me tomorrow, "You're hired." I said, "Yeah, but what time is class? I don't know if I can do this or not." Right. So great things happened in my career because of the APTA, but it oversees the entire profession of physical therapy. We're going to get into that throughout this semester, but laws are created because of what the APTA puts out. The reason we as CCRI can give people PTA licenses, degrees, I should say, in PTA is because the APTA says we can do it. We apply to them and say, "Are we good enough to do this?" And they say, "Yes, you are." Everything from professional conduct, if somebody complains about what you did as a physical therapist assistant, and the Board of Health is going to say, "What does the APTA say about that action?" And then the APTA gets to say if that was right or wrong. So it is the governing body of all of physical therapy. Oversees education. So their branch that oversees education is called CAPTE. And then they also oversee the licensure exams. So after you graduate from the PTA program, before you can become a licensed PTA, you have to pass a licensure exam. I think it's 4 hours long, 200 questions, all multiple choice. And it's created by an arm of the APTA called the FSBPT. So the structure of the APTA at the national level, they used to call it sections. Now they call it academies. So those are areas of interest: cardiopulmonary, orthopedics, neurology, just a subtopic within physical therapy. So I think we saw some of those subtopics there. We saw one person that we saw someone who said, "I'm a neuro PT." So he probably belongs to the neurological academy of physical therapy. So everybody there is just interested in the neurological patient. There's orthopedics, like I said, cardiopulmonary, pediatrics is another one. It's nationally governed by the Board of Directors and the House of Delegates. And groups of similar members can join together in a few different ways. We'll expand on that a little bit, but each state is represented and it's called a chapter. So we have the Rhode Island chapter of the APTA, Massachusetts chapter of the APTA. Some bigger states have more than one chapter: Southern Florida chapter, Northern Florida chapter. So that's how just it's broken down more geographically. So the sections or academies, again, some of the name changes is pretty recent. So there's 18 different areas of interest: acute care, that's hospital. If you think of acute care, that's hospital-based. Aquatics, cardiovascular and pulmonary, electrophysiology and wound management, education, federal PT, geriatrics, hand and upper extremity, health policy administration, home health, neurology, oncology, orthopedics, pediatrics, private practice, research, sports, and pelvic health. Who do you think? What do you think? What are you guys interested in? This 18 sections or academies? You see something that you are a little interested in? Sports? Yep. What else? Any others? What? Pediatrics? Yep. Any others that are drawn to you? Anybody think aquatics is cool? Anybody not think that physical therapy would work in water? That's pretty cool. We use water as to perform exercise in. Depending on how deep in the water you go, there's a certain, it unweights the body. So if we had really arthritic knee, really painful knee. Yeah. Yeah, cool. Where was that? Okay. Yeah. Oh, okay. All right. So it's pretty cool because one, water can unweight that painful joint, and that's really cool. The other thing is, anybody ever try to run in water? How's that work? It's really tough, right? So water not only can unweight a painful area, it also provides resistance to the movement too. So it's a strengthening thing as well as something that can be used to relieve pain. So it's pretty cool. Yeah. Yeah. Absolutely. Yeah. Absolutely. So cool. Any other pieces that pull you that say, oh, that's pretty interesting. I'd like to know more about that. Orthopedics, would you say? Public health? Oh, pelvic health. Yeah, definitely. Pelvic health. That area has exploded in the last 10 years. So yeah. So at the national level, the board of directors are 16 elected members who guide the APTA. Those are the people who really make all the tough decisions. Do you have a question? Oh, okay. And then the House of Delegates have a lot more people. Each chapter has its own delegates, and those are the policy making body of the APTA. I will say one of the topics that's always talked about, and it's been talked about the last at least 15 years, and the House of Delegates is responsible for making this decision or not. Should the PTA degree be moved up to the bachelor's level instead of staying at the associate's level? That's always something that's talked about. And it's up to the APTA to decide if it should be moved up to the bachelor's level or not. We could talk about that later in the semester, but that's a really common thing for us. So there's roughly 100,000 members, roughly 65% of all PTs are members. So there's about 35% of PTs that aren't members. Members can also belong to a special interest group within sections. So in orthopedics, for example, there's a performing arts special interest group. There's also an animal rehabilitation special interest group with both within the orthopedic section. I have one former student, got some extra certifications, and now half of her caseload is canine physical therapy. That's half of what she does. I feel like that's pretty cool. Horses and dogs are the number one and number two animals to have rehab. Performing arts, I knew one PT that traveled with Cirque du Soleil around the country and took care of all of the performers within that. So that was pretty cool. Students can belong to something called the Student Assembly. And PTAs can belong to this special group called PTA Caucus. That is, the PTA Caucus are responsible for discussing issues that only belong to PTAs. So the PTA Caucus will talk about Medicare is going to cut PTA reimbursement by 15%. What is that going to do for our careers? How are we going to fight that? Should the PTA degree be bumped up to bachelor's level or not? They'll have their own input to discuss that. how do we define the levels of supervision? Do we need changes beyond? So that all of those kind of discussions happen within the PTA caucus. So like I said, the APTA is broken into chapters, which represents each state. There are 51 chapters, but this is what I meant. Some chapters are big enough to break into districts as well. Rhode Island doesn't have a district, but Florida will have the Florida chapter of APTA with Southern, Central, and Northern districts within it. So anybody from a different state? Yeah, what states? Wisconsin, Connecticut not big enough, and what? Oh, okay, so North Carolina is big enough, and especially even if some of our more rural states, even numbers wise, they might not need a different chapter. Just regional, geographically wise, we need to have a bigger area. New York, okay, so I don't think New York has different districts to it. I could be wrong on that. So chapters are important to respond to local issues, regarding the local issues that impact the profession, and as well as guide the national levels of the APTA. Each region is going to have its own problems and gives guidance to the national chapter, and the national chapter then uses that information to make decisions. Chapters can also have special interest groups and smaller versions of the sections and academies, like we talked about earlier. So some related organizations to the APTA, the Commission on Accreditation in PT Education, abbreviated by CAPTE, that's responsible for evaluating and accrediting all PT and PTA programs. There's 250 PT programs, around 370 PTA programs. That number always surprised me. I didn't think there were that many PTA, but there are. FSBPT, Federation of State Boards of Physical Therapy, responsible coordination of local boards to regulate the profession. And the big thing that we can blame them for is the creation of that big, long licensure exam that you have to take. There's also a political action committee responsible for legislative support, paying off the politicians to say we like physical therapy, let's keep paying them. That's what they do. So some benefits of membership is members serve and guide the profession, advocate for the profession. It is crucial for us to do so. Just a few years ago, the state of Rhode Island would have been the only state and would have been the only state to remove licensure from physical therapist assistants, meaning anybody could claim to be a PTA. That would have been terrible for us and for the profession. It would have been terrible for us, one, because if there's no license saying, okay, this person has the skills and knowledge to be a PTA, what do you think insurances are going to do? They're going to keep paying for? Nope. And something that happens, and we'll talk about it later in the semester, if someone's an immoral PTA, their license to be a PTA gets revoked. You can no longer work. The most common reasons for that are sexual assault of patients and drug use of some kind. I know of one case that happened in Rhode Island. Woman stole her doc's prescription pad and was writing medication prescriptions, and we said, okay, you can't be a PTA anymore. So if Rhode Island took away the license for PTA, what would every single other state who suspended or revoked licensure of a PTA, where would that PTA move to start working again? Rhode Island. Do we really want that? I would say no, right? So, the APTA, the Rhode Island chapter of the APTA, kindly educated our governor at the time as to how ridiculous of a problem that would have created. And luckily it didn't go through. But that's the power of the APTA. It saved, CCRI's program, if there's no licensure needed, we don't need to have a CCRI program for it because you don't need a license to do it. So it saved jobs, it protected the profession, and most importantly, it protected the community. Looks at different career advancement, different resources, improved practice as a PT and PTA, different networking opportunities, and discounts on different products, just like any Any big organization? Any other big organizations you can think of? AAA is a really big one.
Geico.
Yeah, Geico, is that I guess that, do you get other benefits other than insurances with that? Maybe, I don't know. AAA is an easy one, big organization. You could also save money on this or that, or hotel rooms, rental cars. There's similar types of benefits if you're a member of the APTA as well. So I love this vision statement for what the profession is. The transforming society by optimizing movement to improve the human experience. That's the vision statement for what physical therapy should be. And I just love that so much, right? So there's so much in this statement that that we can look at and pinpoint to and say that's exactly what I was hoping to do, right? Optimize movement to improve the human experience. One word in this that was slightly controversial, not slightly, it was very controversial at the time. Anybody want to pick out the one word that was controversial? Gave a little preview of it a handful of slides ago.
Transforming society.
No, human. It's the human piece, because we do have some therapists that work with animals, and they said, well, what about us? And we said, get out of here, we don't care about you. All right, so that was the one that word. But anyway, in that video, what ways did we see PTs and PTAs optimizing movement to improve the human experience? Yeah, with games. Yep. Any getting to people to walk again. So I want to pause for the games for a second. So the games you're talking about are mostly the guy who worked with the pediatric population. Is that the one you're thinking of? Yep. Yeah, throwing the ball. All right. So usually with kids, we have to create games or else they're going to tell us I'm not doing that. So we have to make it fun. But what do you think which game are you in particular thinking of? Thinking of any? Throwing the ball and catching it. So, okay. All right. And going around in the circle. All right. I want to pause on those two things. Why do you think throwing the ball and catching it was improving the human experience for that patient? What is that therapist also working on? Hand-eye coordination. Anything else? Sure. Yep. And reflexes. Good. Anything else? Reactions. Good. Balance, seated balance. Absolutely. Does the kid need balance to sit in school? Well, he needs it for everyday life, and we'll learn it more, but the school physical therapists, their job is to help these kids with disabilities function within the school environment. Do you guys need sitting balance? What are we all doing right now? Sitting, right? And we're trying to learn. Yes, absolutely. That's improving his human experience by being able to participate in the classroom to the fullest degree. What do you think he was doing with you said driving around in circles with his wheelchair? What do you think he was doing with that? Spatial awareness, you thinking of? Yeah. Yep. What else are we doing? A little bit, yep. That therapist is also having that kid get better at driving his power wheelchair. And those can be really tricky. Anybody drive one of those? Those can be really tricky to drive. If that kid uses or is going to use that type of wheelchair for locomotion, he's got to get really good at it. Yeah, and we might as well have fun while we're doing it. But if that kid can independently drive in between classes, does that improve his human experience? Instead of needing someone else to drive him, oh, we got to end class early because we got to grab this person, they'll drive you to the next class. No, we're going to have this kid who's going to be a teenager in a couple of years, be independent. Absolutely. Yes, it's a heck of a lot of fun, and we're playing a game, and we're going to giggle and laugh the entire time. Or the goal is to improve his human experience. Any other ways we improved human experience? Explain to me more. Yep. Any other ways that we improve the human experience with that in that video? Exercise. Yeah, just pure exercise is improving human experience, especially I think what you're thinking of are the army guys. Yeah, 20-something-year-olds have known nothing but exercise for their life. Guess what? We're gonna get back to breaking a sweat. We're gonna do some really hard stuff, climbing walls, rock climbing, running. Yeah, we're gonna improve the human experience by getting back to things that you love. Yeah. So I think that's so powerful for us to understand. So what is a physical therapist? Physical therapist is professional practitioner of physical therapy services, healthcare professionals who help individuals maintain, restore, and improve movement, activity, and functioning, thereby enabling optimal performance and enhancing health, well-being, quality of life. It's a lot more words to basically say optimize movement to improve the human experience, right? Um, so there's a bunch of other definition that can be important, but really it's the people who optimize movement to improve the human experience. What about a PTA? PTA is a clinical-based problem solver. And that's what we get to be as PTAs. It is the only person, only individual who can assist the physical therapist in practice. How many people are techs right now, either aides or techs, anybody? So the APTA would say techs can do things like wipe tables down and get towels ready and walk people to their cars to make sure they don't fall down, but they do not provide physical therapy services. Only a PT and a PTA can. Legally, the PTA cannot perform any evaluations of any kind, initial reassessments or discharge evaluations. So that is crucial for us to know, and that will be something that pops up on exams, okay? So make sure we understand that. So the physical therapist can perform the examination, the evaluation of the patient. We develop the plans of care. The PTAs can treat that person, but not perform those evaluations. Now, each state has some slightly different guidelines to exactly what treatments PTAs can perform. Each state has a group of laws governing the practice of physical therapy called the Practice Act. Each healthcare profession does have a Practice Act, but when I talk about Practice Act, it's just about physical therapy. We're going to mention that often. In Rhode Island, I can, as a physical therapist, can perform spinal manipulations. I can also do dry needling. In California, I don't believe I can do either of those things. So each state has some variability between what exactly it goes right down to individual treatments. As a physical therapist, I won't, but I could remove dead tissue from infected wounds using scalpels and tweezers. We call them sharps. I could do that. I'm not going to, but I could. The law says I could. PTAs can remove dead tissue with non-sharp treatments, water jets. You could do wet to dry dressing. That's fun, where you put a bandage on a wound wet, you let it dry, and then what do you think you do? No, you rip it off, and what comes off with it? A bunch of tissue, right? Tough way to make friends. Hi, I'm Josh. Let me help you out today. Here's what we're gonna do. You know that dressing that dried to your open wound? Don't worry about that. Yeah. Yeah. Yep. 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 That's exactly what we're talking about that PTAs can do if you wanted to. Does anybody, well, now that I'm mentioning wounds, anybody be like, wow, I can't believe wounds. This is pretty cool. Anybody interested in wounds? I always get one person. Yeah, all right. Yeah. All right. You can have them. You can have them all. Yeah, I don't not part of what I want to do, but hey, whatever. It can be that there's some places that would pay more, but most of the time, no. Right. Yeah. Yep. So PT aides, I try to call aides technicians in this class, just because when I talk quickly or it's late in the day, I've been talking since 8:30 in the morning and I start to mumble. Sometimes it's tough to tell if I'm talking about PTA or a PT aide. So I usually call PT aides techs. Okay. So when I'm referring to techs, I am referring to a PT aide. Supportive personnel performs designated tasks in relation to the operation of PT service, do not require clinical decision making. Different states do have different practice acts that give us guidelines into exactly what they can perform. In Rhode Island, techs can perform things like ultrasounds, therapeutic ultrasounds, can apply some different modalities like e-stims and hot packs and cold packs. I have my own personal opinion on that you'll hear at some point in our time together. But for today, I know that techs in Rhode Island can do that stuff. Not every state we can. So. All right. Any questions on the APTA or how that's broken down? We'll review it in a little bit, but. All right, so history of physical therapy. Since the dawn of time, there's been use of physical medicine as early as Chinese massage, 3000 BC, Hippocrates in 460 BC, hydrotherapy with the Greeks and the Romans, use of electrotherapy starting in the 1600s. People used to get hooked up to, I don't know who was flying the kite with the key on it, but somebody was hooked up to electricity around there. So in the United States, two major events have consistently increased the demand for physical therapy: disease and war. Anytime there's disease or war, the need for physical therapy has grown. And recently, that's absolutely true. It still rings true, whether it's the most recent Afghanistan war or the COVID pandemic. There has been a huge need for PTs for those people. The first two instances were the polio epidemics and World War I. And in 1917, the U.S. Surgeon General sent a group of physicians to England and France to learn about physical therapy techniques to better care for the wounded. This started the formal education of reconstruction aides. The reconstruction aides were the first PTs and OTs. So that's where we all got our start there. In 1921, reconstruction aide Mary McMillan, be still my beating heart. Mary McMillan and Taylor Swift. Those are my two big celebrity crushes. I don't know if Mary's looking too good nowadays, but I know in her time. She's known as the first physical therapist. That's one of the reasons I love her so much. Elected as the first president of what was then known the American Women's Physical Therapeutic Association. Soon after, reconstruction aid was changed to physiotherapist. The name changed a couple of times. In 1922, it changed to the American Physiotherapy Association, and then they admitted their first two male members in 1923. So congratulations, men. We broke through that glass ceiling, never to look back. And in 1947, the professional organization changed to the American Physical Therapy Association. There were some reasons for that we just don't need to get into, but that's the way the name has been for now. So in World War II and the second wave of polio epidemics, continued to increase the demand for physical therapy. In the 1960s and 80s, kind of fast forward a couple of decades, continued growth, recognition of education, practice, and research. Some other factors that influenced growth was the aging population. Federal health care coverage, so Medicare and Medicaid being created. Health promotion and disease prevention is started to become more and more popular. And increased use of direct access. Direct access is the right to conduct physical therapy exams and interventions without physician referral at first. So all of those things continue to create more and more demand for the profession. Now, modern PT, we saw a skyrocketing of healthcare costs as well as increased focus on evidence-based practice. Vision 2020 was something that the APTA put together to evolve the practice of physical therapy, which included autonomous practice, increased direct access, development of the doctorate education for physical therapists. The education for physical therapists started at the bachelor's level and then morphed into the master's level and then advanced master's and then doctorate. I know of 2 physical therapists still practicing who have their bachelor's level. They never got beyond a bachelor's level. So evidence-based practice using the best evidence, not just our gut feeling, different professionalism, as well as different branding. They started a Choose PT campaign where it tried to say, if you're hurt, come and see physical therapy. You don't have to go anywhere else. Just come and find your best physical therapist close to you. So I have some. I don't mind the campaign, but our patients don't choose. Like nobody wakes up. Anybody just wake up and just think like, wow, today's great. I feel great. Life is good. I'm gonna go to physical therapy and see what they can do for me. No, like something happens. I think it's a little misguided, but hey, any branding's good branding. All right, so here's what I want to do. I want to think of the path of a patient and then how the physical therapy world works with that patient. So let's pick someone we all have a working knowledge of. Somebody famous, somebody that we all know. Anybody come to mind? We don't know favorite celebrities. You want to just get me completely sidetracked and we can just run through the top 100 songs that we like? You want to use Taylor? I don't know if I can keep my composure, but all right, we'll use Taylor. All right, what kind of diagnosis would we like to give her? Something easy, something. Plantar fasciitis, not bad. Does everybody know what plantar fasciitis is? Let's go something a little bit more. How about a sprained ankle? How about a really badly sprained ankle? Is that something we're all a little familiar with? Anybody ever roll their ankle and it hurt for a couple of days? All right, so let's give her a sprained ankle, but make it really bad. So, sprained ankles can range anywhere from 1 week healing recovery to 12 weeks, depending on how badly those ligaments are damaged. So let's give her a moderate one. Now, what kind of problems would that patient complain about due to the sprained ankle? Walking, painful with walking, inability to walk. Problem performing on the stage, definitely. I mean, she's got how long are her shows? Forever. You just shut your eyes. You're at the show right now. That's what I do. I'm front row right now, right? So yeah, a few hours a night, right? And does she just sit on a stool and strum a guitar? No, she's all over the place, right? What kind of footwear does she need to wear for that? A whole bunch of different types of ones, right? So yeah, not the easiest thing for a sprained ankle to do. Anything else you might complain about? Swelling. So do you think she would complain about that swelling? Or do you think that's something she complains of the pain and the inability to walk and work and the swelling's just kind of there? Yeah. Yeah. All right. I think she'd be tough and say, I don't care about it. It's my fans I care about. All right, so swelling, good. Anything else? Stability. So yeah, I feel like I'm always gonna roll that ankle. Definitely. Good. So she's got pain, inability to perform, trouble walking, poor stability, and swelling. How do you think we could measure those issues? Start with swelling. Do you think we could measure that? Compare it to the other side. Definitely. Yeah, man. If we've got one good side to go, not everybody in that video did have a good side to go with, right? So, yes, if we have another good side, definitely we can compare it to the other side. How do you think we would measure it though? So what I will say is measuring things in physical therapy is so important because we need to measure for signs of progress. Don't worry, Taylor, we are getting better. You were at this number before, now you're at this number today, right? So that gives us concrete evidence that we're getting better. It also helps us make decisions about today's treatment. Wow, this swelling is worse than the last time I saw you. Oh, yeah, well, I got to meet this one fan. He's a college professor. He showed me around the state. It was a great time. I forgot completely about I felt like I was walking on air the entire night. So, yeah, I mean, maybe the swelling is a little bit worse today than the last time. All right, if swelling is worse today than it was last time, how do you think we would change our treatment today in the physical therapy setting? More ice. Great. Perfect. Hey, you know what? We usually only ice for 10 minutes. We're going to ice it twice today. Actually, we're going to do a contrast bath to really attack this swelling. We're going to go hot first, then cold, then hot, then cold, and really try to attack this. I'm also going to use the ACE wrap. We're going to wrap you up at the end, really try to flush out that swelling. We also have these different electrical currents that we can put on you that'll help drive that swelling away too. And at the end, I'm going to show you how to elevate your foot properly so we can do that. Yeah, so our treatment today could be completely influenced by what measurements we take. So really important to learn what measurements we can take. Any other things that we could measure with those? Yeah. Yep. Yeah. So we could take, so that's looking at range of motion measurements. Yeah, definitely. And there's different tools we can use called goniometers that could help us with that. Yep. How about pain? Do you think we can measure pain? How do we measure pain? Tell me how much pain you're in, 0 out of 10. Now, you guys, we've all been sitting in our chairs for over an hour now. Anybody's back a little stiff? Yeah. 0 to 10. Tell me how much pain you're in. Oh, yes. So what I'll tell you, if you need to, get up and move around. If you need to get up and just stretch in the back and just stand in the back, that's fine. If you feel like you just need to take a quick walk, go take it. Like, these aren't the most comfortable chairs, so feel free to move around. You are not going to distract me if you get up and stand in the back of the class for a little bit, okay? Well, yeah, we can measure her pain. We can measure anybody's pain. And if she starts out saying it's 7 out of 10 pain, and 3 weeks later it's 3 out of 10 pain, great, we're making progress. Happy, great. We can measure her balance ability with a bunch of different ways. Why don't we do this? Let's all stand up. All right, you can stand next to your desk. You can have it right next to you. Let's do this. Let's stand on one foot. You can have your hand next to your desk, but try not to touch anything. Good. Anybody need to put their foot down? Stand here for a while, right? All right, try the other side. All right, it's my bad side. If you feel like you're going to lose your balance, and okay. All right, so you can stand there for a second, both feet on the ground. So if we needed to, we could measure that. We could time it. How much time does it take? Something I do with my patients, I work with mostly geriatric patients. How much time can you stand on one foot? And then we compare right to left. Hey, 4 seconds here, 20 seconds here. This side we need to work on, right? All right, let's make it a little bit harder for us. Keep your hand hovering up over your desk, but don't touch it. Stand on one leg. Now shut your eyes. All right, open them up. How many people needed their foot down or to touch their table? Okay, so now what we can do, let's try it on the other side as well. Same thing, the other side. Oh, that did not go well. Major differences, right versus left? Do you have them now? Okay, so part of the skill of the physical therapist is knowing which test to use, okay? So for all of us in here, eyes open, single leg stance test, it's not really going to give me much information. Eyes closed gave us a lot more, right? Because on one side, we lasted X amount of seconds. On the other side, we lasted a different amount, okay? So let's go ahead and sit down. So we can measure balance in a bunch of different ways. That was just a really quick example of it. So we can measure for signs of progress, and we can use it to make decisions based for today's visit. Now, we already talked about this. How would her issues of this ankle pain, how would that impact her function? Tour, boy, what are we going to do? This is completely different tour now. And do we cancel some shows? Do we not? Like, there's a whole lot there. And how many people rely on those concerts for money? I mean, not only everybody from parking lot attendant to food vendors in the stadium. I mean, there's a lot of people that really need this to happen, right? So, not just her. Now, if she wanted, could she just pay a handful of people just to carry around all the time? She could pay you guys. What is the? I got my mind on Greek and Roman times. What are those things called where people hold and there's like a little velvet like structure? I forget what those things are called. Could she pay a handful of people just to carry around like that? The woman never has to walk if we don't have to, right? Yeah, maybe that's how. Maybe we modify. All right, you're the hired choreographer for the next show. um, so it's going to impact her function, but she has some resources to get around those problems. If her house, if the bedroom was on the second floor, you could just buy a house with a bedroom on the first floor. You could do that in a minute, right? Sure. Yeah. We could throw in one of those chair lifts tomorrow. I guarantee you somebody would do it for her tomorrow. Yeah, or put in an elevator. She probably already has one. You're right. She could find the unicorn to fly her into the top floor. She could do anything she wants, right? But for some of our other patients, anybody here live on a second or third story apartment or bedrooms upstairs? Any elevators for you guys? Nope. Right. So how would a severely sprained ankle impact your ability to get to your bedroom, to get to a whole lot, right? So, knowing a lot about our patients, not only, I mean, we could all have the same problem, but how it impacts us, guess might affect you getting home, but you also don't have to put on a concert for however many hours a night, right? Too. So, it really changes, how are we going to optimize movement to enhance the human experience is going to be different for every single person because the human experience is different for every single person. So what I'd like to do is show you this patient client management model. I think this is the last thing we cover for today. So this is how the patient interacts with physical therapy. It starts with examination. Examination is something that you can write this down that the physical therapist will do. I think of anybody like doing puzzles, jigsaw puzzles. So I think of examination as opening up that jigsaw puzzle and dumping out all the pieces. Organize all the edge pieces over here, all the red colors over here, all the browns over here, right? So you're just kind of like figuring out the pieces of the puzzle. That's where we measure balance. That's where we measure pain. That's where we measure the swelling. That's where we measure anything else that could be measured. What do you do for work? Where do you live? All of that kind of information comes from the examination. The evaluation is kind of abstract. It's the dynamic process of putting those pieces of the puzzle together. So when you have an ankle sprain versus Taylor Swift, do I really have to work hard today on Taylor Swift's ability to walk up and down stairs? What's probably more beneficial than that? Maybe working on standing balance so she can walk in heels again. Right? I mean, walking in heels for her, like if we could get that done today, let's go for it. Do you need to learn how to walk with heels today? So what would be more important? Learning how to walk up and down stairs, because that's what we got to do today, right? So the evaluation is taking all of this data, not only from the patient's injury and what we know about it, but also taking information about their life and trying to figure out, okay, what's the plan? What do we think is happening here? And what do we think the plan will be? For Taylor Swift, walking in standing balance and narrow surfaces like walking in heels and fancy shoes is a high priority. For most of our other patients, getting up to their bedroom on the second or third floor is the high priority. So that's where the evaluation is. It's taking all that data and making sense of it. After that, we come up with a diagnosis. Now, the physical therapist does examination, physical therapist does evaluation, physical therapist also comes up with the diagnosis. The PT diagnoses, we don't diagnose the problem itself, the disease or the injury itself. We diagnose the impairments the problems that injury causes. So not everybody with a sprained ankle will have tremendous pain. Some people have tremendous pain. So the diagnoses are really long, but really we're looking at the consequences of the condition rather than just saying, oh, I think you had a heart attack. No, it's not my job to tell you if you had a heart attack. It is my job to say, you have a heart problem and you can't walk greater than 35 feet without sitting for a rest. Like that's the consequences of the problem. Does that make sense? It's a little weird. After that, the physical therapist will come up with a prognosis and the plan of care. Now, I will tell you, I sometimes talk about plan of care separately than prognosis because it's really important. Prognosis, anybody know what prognosis is? What's going to happen? What's going to happen here? So, Taylor Swift, 30-something, otherwise healthy. You think any problems with the sprained ankle? Think recovery? It's going to make a full recovery, right? No reason to think she wouldn't. How about who can think of somebody's grandma, sprained ankle, was living alone, cluttered house, barely making it to the mailbox every day, has arthritis, maybe has a heart condition as well. How do you think grandma's going to do? Boy, that prognosis is a lot different, right? So it is just a sprained ankle, but the person that it's attached to is significantly different. So we've got to really figure this out now. So prognosis is how much better are we going to get? Also, how much time is it going to take? Taylor versus grandma, who takes longer to heal? Grandma. Taylor versus high school athlete that has the same injury, who takes longer to heal? Taylor, most likely. Just age alone is teenagers heal very quickly, and anybody that's not a teenager heals a lot slower. So, prognosis, how much better are we going to get? How much time is it going to take? Those are the two major factors. Now, I talk about plan of care separately, although most of the time other people consider part of the prognosis. I talk about it separately because it's so important. The plan of care is, anybody here a good cook? Yep. Any of you are not a good cook? Willing to admit it? All right. When we're not a good cook, what do we need to use to make dinner? A recipe, right? And when we have not a good cook and we use a recipe, what do we have to do with that recipe? We have to follow it to a T, right? If it says quarter teaspoon, we got to measure a quarter teaspoon, right? If it says bake it at 350 for 25 minutes, guess what? It's going in at 350, 25. Our good cooks in the room, what do you guys do? Do you guys use recipes? What do you do? What's different? Yeah, you're a perfect person to ask. Tell me, do you use the same recipe every single time? Did you bake today? What did you change today versus what you had to do 2 weeks ago?
And what I bake or what I cook, 'cause I cook it when I bake it.
I guess bake. I think that's what I'm thinking.
Well, baking, I do follow a recipe because.
And you're doing more commercial purposes, so all right. But did today's heat impact the way you baked? Tell me how. Yeah. All right. Anybody I didn't know any of that, right? So she and I are gonna have the same recipe. I'm gonna say my cookies, what did you say, tacky? My cookies are tacky, the chocolate's not solidified. but I followed the recipe, right? And she said, yeah, I followed the recipe too, except put him in the freezer. I did, or she did all of her magic, right? So the plan of care is the recipe for physical therapy. As we're less experienced, you follow that recipe to a T. It says to do this balance exercise. It says to do this for swelling. It says to do that. Being a clinical based problem solver, though, when it's too hot out, the clinical based problem solver baker, the experienced baker, knows how to adjust to the environment. Same thing, we are the clinical based problem solvers, the experts on our patients. And when they come in and say, I have more pain today, my ankle's more swollen today, here's what I did, and here's the repercussions of that, we're going to know how to stay within the plan of care. We're still baking cookies, but we're going to adjust within that plan of care to get the best outcomes as possible. Does that make sense? Does it make sense to you? Sometimes I use that analogy and it could potentially fall apart. So the plan of care is the recipe. Now, if we order cookies and you give me cupcakes, did you follow the plan of care? Did you follow the recipe? No. So we have to be careful we operate within the plan of care. That's very important. If balance activities aren't in the plan of care and you think the patient needs it, your job is to then go back to the physical therapist and say, we're missing something here. I saw this. That can happen. The patients change over time. I don't see everything day one that you're going to see as you start working with your patient. That's the collaborative approach that we've got. Or there might be a reason why I said we're not going to operate. We're not going to do balance exercises. There could be an underlying condition that would make us not want to do certain things. So anyway, so the physical therapist comes up with the prognosis and the plan of care. Intervention is execution of that plan of care. Either the PTA or the PT can perform the interventions. So finally, the PTAs get to do a little work.
Doing like a balance for somebody, let's say they went to like Disney with their kids to get for
Yep.
like sort would that be something that would make you like stray away from that balance stroke?
It's something to consider. So if somebody, you know, it doesn't matter if they went for a jog, had a long day at work, you know, doesn't matter. If they complain about anything, exertion of any kind, they come in the next day, it's something to consider to see if we want to do this or not. I didn't see any patients today because I've been working all day long. If I did see patients today, most of my patients are geriatric. Most of them don't have air conditioning. I would have not done any exercise with any patient today. It's not worth it. We're not going to get, I'm only causing a risk of a problem. If I had a patient say, hey, I went to Disney, I just came back from Disney, my legs are sore, I might do the balance work. I might not. I have to feel what that looks like at the day. So. All right, now, if we do our jobs correctly, we get the best patient outcomes. In physical therapy, there are three main outcomes we can achieve. I keep trying to come up with another one, but these are basically it. Outcome number one, return to prior level of function. I usually abbreviate that PLOF. I'll write that at some point. Getting Taylor Swift back on tour, getting you walking up and down the stairs without pain up to the apartment, right? Getting back playing basketball, getting back to being a student, whatever you were before this injury or problem, we want to get back to that. Getting back to jiu-jitsu and working full time and wrestling with the kids, right? So that's the most common thing we think of is return to prior level of function. Not everybody can return to prior level of function. How about those guys with the amputation, the leg amputations? Can they ever return to prior level of function? They will never return to prior level of function. Now, doesn't mean they can't run marathons, go rock climbing. It doesn't mean any of that. It means we can still do that, but we are going to do it differently than you were before. So the next thing, return to prior level of function, number one. Number two, Improve current level of function, CLOF.
What was the first abbreviation for the return of prior level?
PLOF. So it's easy to think of those guys with the leg amputations. When it first happened, could they get out of bed by themselves? No. I mean, young and athletic 20-something-year-olds, they might have been able to really like gut their way out. Like if anybody could, it was them. But how about bathe by themselves? Learn, figure out how to get in and out of the shower by themselves, make food for themselves, dress themselves. I mean, life is a heck of a lot different now, right? I guarantee you there are PTs and OTs working with these people to teach them the most efficient ways to get out of bed, to get in and out of the shower, to bathe themselves, on and off the toilet, to dress themselves, all of those things. So we can improve current level of function. And the last outcome we have is minimize the consequences in the future. Not every injury or disorder has consequences in the future. Those guys with a leg amputation, you know what, something we have to be really careful of? Skin breakdown on the residual limb. So where that prosthetic fits onto their residual limb, if the skin starts breaking down, what's going to happen for them? Can't wear the prosthetic now until that heals, right? So how does that change that person's life? Back to square one, right? So we have to educate them. And how many young 20-year-old, how many of us in here are young and 20 and not going to admit it, right? But how many young 20-year-old guys like hearing how to be careful? Yeah, all right. So it can be tough. That can be a really tough thing. But man, how important is it to say, listen, if you get some sort of wound on this, we can't wear your prosthetic until that wound is healed. So it can be. So those are the three major outcomes: return to prior level of function, improve current level of function, and minimize consequences in the future. I think post heart attack is a good example of this too. Somebody has a heart attack. Now their walking endurance is greatly affected. Can we return that person to prior level of function? Possibly. Depends on the severity of the heart attack. Depends on what their prior level of function was before. But let's say we can't. I mean, a massive heart attack, they're going to be forever impacted. We can improve current level of function though, right? And then what do you think is really important though? Minimize the future consequences. How do you think we would do that for the guy with the heart attack? Anybody?
Walking, slight running, build cardio.
Absolutely. Exercise to build the cardiac muscle up, exercise to make his heart as efficient as it possibly can be, education on the importance of it. Anything else? Diet, maintaining a healthy weight. Those things are incredibly important. Now, does anybody here have experience giving somebody nutritional advice after a heart attack? I don't either, and I wouldn't. But I would encourage the heck out of that person. Let me help you find someone that can. This is crucial. We want to, do whatever for the rest of your life. So we can do this together. And maintaining a healthy weight. That's a conversation I can have. Why is that important? Decreases stress off the joint. I mean, physically, you're going to feel a heck of a lot better everywhere else, never mind the heart. But guess what? The heart's got to pump blood to all this tissue here. If we have less tissue, the heart doesn't have to work so hard. absolutely can have those conversations. So that's where minimizing the future consequences can be really important. All right, does that make sense? All right, so here are some abbreviations to know. There's that PLOF and CLOF. Plan of care is POC. If you ever see PT in the lowercase, that refers to patient. Capital PT refers to physical therapy or physical therapist. That's a good one to know too. So, all right. So that's what I've got for today. Now, make sure in your studies you go back to the second slide to look at the objectives. If you can, turn these objectives into questions. If you can answer those, you know everything you need for the whatever exam we have. Okay?